Hi, this is Andrea.
Hey, this is Eliana, and today we're going to be talking about injectable birth control. Thanks for taking the time to listen.
Birth control that is injected with a needle intramuscularly or subcutaneously every 3 months. What are my options? Option 1 is Depo-Provera, depomedroxyprogesterone acetate, DMPA, which is given intramuscularly in the arm or buttocks by a healthcare professional. Option 2 is Depo-Sub-Q-Provera, which is a lower dose and is given subcutaneously in the thigh or abdomen. This version can be self-administered at home. Where can someone get Depo-Provera? They can get it from their doctor, health department, or Planned Parenthood. It might cost up to $100, but with insurance, it could be low cost or free. Depo-Provera contains progestin, which stops ovulation and keeps the ovaries from releasing an egg. It thickens and decreases the amount of cervical mucus, which makes it hard for the sperm to reach the egg. It thins the lining of the uterus, making it hard for a fertilized egg to attach to the uterus. More than 99% if used perfectly. But effectiveness goes down to 94% if not received on time, which means 6 out of 100 women will become pregnant. Users should know that their first shot will be given within 7 days of the start of their period to make sure they aren't pregnant. If they don't receive it during that time, they need to use a backup form of birth control. Users should also know that it is important to receive their next injection 12 to 13 weeks later. The injection can be given up to 15 weeks late, but a backup form of birth control must be used.
Depo-Provera has many advantages. One of the few is that it's private and no one can see nor know that you have to have it. It also lasts up to 12 weeks, so you don't have to think about it every day like an oral contraceptive. And lastly, it doesn't interfere with sexual intercourse. Moreover, it decreases menstrual cramps and pain, makes periods lighter, reduces the risk of endometrial cancer, and it isn't permanent, so having a baby is still an option. Despite its many advantages, Depo-Provera has some disadvantages, such as users have to remember to get injections every 3 months. It can take up to 10 months to get pregnant after stopping injections, and it doesn't protect against STDs. Risk. There is still a chance of getting pregnant. According to studies, 6 out of 100 women reported getting pregnant. In addition, there is also a still greater chance of suffering bone loss, which can lead to osteoporosis and fractures later on. Precaution. If there's a family history of bone loss or eating disorder that can contribute to bone loss. And consult a healthcare provider if there's signs of depression, heavy bleeding, trouble breathing, severe lower abdominal pain, allergic reaction, prolonged pain, redness, itching, or bleeding at the injection site. Contraindications contraindications against the use of Depo-Provera is if there's a history of unexplained vaginal bleeding, breast cancer, liver disease, osteoporosis, depression, heart attack, stroke, or sensitivity to components of Depo-Provera. So, what are the side effects? Nausea, weight gain, headaches, breast tenderness, depression, irregular bruising where the shot was given, or irregular or no periods, such as spotting in between cycles. An ideal candidate would be someone that doesn't want to worry about taking birth control every day. Someone that doesn't want everyone to know they're taking birth control. A recommended population would be people who have anemia, seizures, sickle cell disease, endometriosis, and uterine fibroids. In addition, I'll be talking about more a case in Nicaragua after our presentation.